Loading of Embazine TANDEM microspheres with doxorubicin HCl powder. For demonstration purposes, this video will illustrate the loading and preparation of 2 milliliters of Embazine TANDEM microspheres with 100 milligrams of doxorubicin HCl reconstituted from powder. Embazine TANDEM microspheres drug loading should be performed under controlled aseptic conditions in order to minimize the risk of microbiological contamination. Do not use liposome formulations of the drugs or ionic contrast agents. Please refer to the Embazine TANDEM microspheres instructions for use and loading guidance, as well as the instructions for use of the chosen drug for dosage, handling, storage, toxicities, adverse events, and contraindications before beginning the Embazine TANDEM microspheres device preparation. Step 1. Preparation of doxorubicin solution from powder. Remove the flip cap from each required vial of doxorubicin powder. Connect a sterile 18 to 20 gauge standard needle to a syringe. Draw up 2.5 milliliters of water for injection, also referred to as WFI, for each vial of 50 milligrams of doxorubicin powder being used. Add 2.5 milliliters of water for injection to each doxorubicin vial. Then discard the syringe and the needle properly. Mix well in order to dissolve the doxorubicin completely. Step 2. Preparation of Embazine TANDEM microspheres. Open the TANDEM box and inspect to ensure that the sterile package is free of damage and its sterility is not compromised in any way. Open the package and gently swirl the syringe to loosen the microspheres. Then, let the microspheres settle to the plunger. Attach a 5-micron sterile filter needle directly to the TANDEM syringe. Insert the needle into a waste solution bag and expel excess transport solution. Do not compress the microspheres. Remove and properly discard the filter needle. Step 3. Drug loading into microspheres. Attach an 18 to 20 gauge sterile needle to the microsphere syringe. Insert the needle into the reconstituted drug vial and draw up the required dose of doxorubicin directly into the microsphere syringe. Repeat this with the second vial of doxorubicin, which is necessary for this demonstration dose but will vary depending on the needs of each patient. Leave an air bubble in the microsphere syringe in order to aid in mixing. Remove the needle and recap the syringe. Alternatively, if using a separate sterile syringe for the doxorubicin, transfer the doxorubicin to the TANDEM syringe via a 3-way stopcock. Mix by gently inverting the syringe every 5 minutes for the first 30 minutes of the drug loading time. Thereafter, mix occasionally for the remaining time period. Full drug loading time period should be 60 minutes total. Following this loading procedure, 98% plus or minus 2% of the doxorubicin should be loaded into the microspheres within 60 minutes. Some faint color may remain in the solution. This is to be expected. Step 4. Removal of supernatant. Attach a 5-micron sterile filter needle to the microsphere syringe. Let the microspheres settle to the plunger. Expel as much of the supernatant solution as possible into a waste solution bag. Do not compress the microspheres. Remove and dispose of the filter needle, then recap the syringe. Step 5. Adding contrast agent to Embazine TANDEM microspheres. Attach an 18 to 20 gauge sterile needle to the microsphere syringe. Draw into the syringe a minimum of 5 milliliters of non-ionic contrast agent per 1 milliliter of Embazine TANDEM microspheres, or a mixture of both contrast agent and water for injection. Remove the needle and recap the syringe once more. Alternatively, an additional syringe containing the contrast agent or contrast agent and water for injection mixture can be used and transferred to the microsphere syringe via a 3-way stopcock. Gently agitate by inverting the microsphere syringe. The addition of the contrast agent to the TANDEM microsphere syringe is intended to be performed just prior to the syringe's use in the patient's procedure. Before mixing TANDEM with any drug, it is important to understand both the microsphere's instructions for use and loading guidance, as well as the instructions for use of the particular drug chosen for each patient's procedure. This video is not intended to replace the instructions for use or loading guidance. CeloNova hopes that this video helps to clearly illustrate the suggested steps for the mixing of Embazine TANDEM microspheres.